chatting with John Barnes, the father of myofascial release, about women's health and a myofascial release perspective, and a little bit more. Enjoy.
Okay. So here I am with John, and we are going to talk about women's health. So, the more I think I've taken your class 2 or 3 times, and I've had other women's health courses too, but every time I take your class, I'm amazed at how important it is and how it makes me feel that every woman should have this treatment regardless of, where the pain is in their body, just from things that I've experienced. So I had problems before childbearing, and then the childbearing was 2 C-sections, and that's a whole slew of things. But I also have seen so many people lately who've had women with hip pain, or maybe they want them to have hip surgery, but no one's even looked at their pelvic floor or even thought about it. And so I am just gonna start it with that and let you.
Okay, well, woman's pelvis is wider than the male pelvis, so it's more easily torqueable.
Mm-hmm.
Woman's joint surfaces are flatter than the male, so they're more easily movable in trauma in particular. Every time you get your period, relaxin is poured into your system, so your ligaments are more slack and more set up for trauma, basically.
Mm-hmm.
Most of the people we see and most of the therapists that I've trained have found that 90% of women have a twisted pelvis.
Mm-hmm.
There's a scenario that goes along with that, and this goes for men too. Men's are more from direct trauma. Also, molestation and rapes and horrible things like that can also create severe problems in the pelvis area. Emotion,
mm-hmm.
and that solidifies your pelvis and twists you. So if my hands are the pubic symphysis, what happens when the pelvis is torqued, the pubic symphysis is forced to shear. Mm-hmm. That produces a long leg on one side, and it shortens the other one. It starts to cause all sorts of problems down to the knee, ankle, and foot, and above, because that's the foundation of our being. The very balance point of our body is the second sacral segment. So when the pubic symphysis shears, the subconscious is now interpreting that as no stability.
Mm-hmm.
It throws you into a fight or flight response. Here we go back to that damn mind again. If you're stuck in a fight or flight response, which just about everybody is, there's no healing possible.
Mm-hmm.
Because you're in that protective mode we've been talking about. Then you have a long and a short leg. Now your subconscious is perceiving your world's not under you. You're in danger. More fight or flight response. So if your alarms are ringing for any length of time, after a while you accommodate, you don't hear them anymore. Fear has great value. It helps us move away from trauma and horrible things. But if you're not hearing your alarms, now you're in danger. Now fear is against you instead of there to help you. Mm-hmm. We're not meant to live in fear. Channel 5 is also living in fear. So after a while you become exhausted because your body is ready to fight or run constantly.
Mm-hmm.
Exhaustion, that leads into anxiety, that leads into depression. People don't come to see us for depression, someday they will. But what we hear from our patients all the time is, since you've been treating my back or my headache or whatever, I'm not anxious anymore, or my depression lifted. So that there's a strong, huge physical reason for a lot of people's depression and anxiety.
Mm-hmm.
So, you hear all the time from women, they go to the gynecologist, oh, your uterus is tilted. I mean, what they think, one day you're walking on the uterus says, I'm going to tilt. The uterus and all of your organs in the pelvic bowl are surrounded, influenced, and completely controlled by the fascial system. So when your pelvis twists or you have direct trauma, birthing injuries, as the fascia tightens, it's going to change the position of your uterus, your fallopian tubes, your ovaries, all that good stuff. Mm-hmm. So it acts like an anchor. So now you have the dural tube is the internal fascial system. It goes inside your spine, all the way up and becomes the covering of your brain. So think of it as a pulley system. As your pelvis is pulled forward and torqued, it's pulling the dural system down. If my hands are vertebrae, it's jamming the vertebrae together and twisting them. Bulging disc, jamming facet joints, back pain, neck pain. Mm-hmm. And then you get the old fiber fog thing. Because your brain's not getting enough oxygen. You're not getting all the nutrition that you put in your mouth. Mm-hmm. It's not receiving the fluid it desperately needs. So it's a very bad scenario. So, do you have anything specific about women's health you want to talk about?
We talked about the organs and the issues there, but even something as simple as hip pain, it's right there. It's this far away from all of these structures in the pelvic floor, right? And so, it's mind-blowing, I think, to me. There's so many people with hip issues, women that I see with hip issues, and it's never a thought to think of the pelvis and the pelvic floor and the treatment of that. So, at some point, I know you added the women's health course, I don't know, 10, 15 years ago or something. It was something that you were treating all along, but do you have was there something that really kind of brought you to this place where you're like, this is what we need to start addressing this more, or just something started happening, you started seeing women get better with these women's health issues?
Well, let me go back to the hip for a moment. If my hand is the femur, the leg bone, and this is the femoral head, then you have in the hip, it's called the acetabulum, so it moves within there. Mm-hmm. So if you understand the fascial system, if you have restrictions in the adductor and pelvic floor area, it's driving the femoral head into the acetabulum. Mm-hmm. Every joint of our body, not just the hip, we need what's called joint space so the joint can move. And within that joint space is joint play, and there should be synovial fluid for lubrication. So whether it's the vertebrae, the upper cervical area of the hip, fascial tightness with enormous force is driving these joints together. Mm-hmm. So we've lost joint space, we've lost joint play, and it starts to break the bone down, roughen it up. It creates inflammation, pain, and restriction of motion. Mm-hmm. You asked me how I got into the women's health thing. I was treating an old osteopath. He was a sweet old guy, and so he didn't have a lot of money, so he started to teach me some osteopathic manipulation techniques, and I gave him free treatment. So one day I was referred to a patient who had fallen on the ice on her butt, and she was having a horrible pelvic floor and coccygeal pain. So I knew that he had talked once about doing internal work, so I called him and asked him if he could talk me through it, and he did. And so, of course, other people do internal work. They manipulate or trigger point, which is just too quick. So I did what he said, and I just spent the time necessary to treat the fascial system. And she had this absolutely remarkable turnaround. So I realized how important that was, and nobody was really doing it properly. Mm-hmm. So the course has taken off beautifully, and men come too. And the first day, people are kind of agitated because it breaks a lot of taboos. Mm. Yeah. That's one of the things I say to everybody is we're going to break some taboos here. But when you break these taboos, you don't realize, you intellectually may have thought that doesn't work for me anymore. But on some level, these taboos were taught us when we were very young. Mm-hmm. And so it gets in the way of our normal life. You're going to hell. Oh my God. But on some level, you still believe that. Mm-hmm. Even if you meet somebody you love and you want to be touched and all that, and it's just a bad scene sometimes, So when you break a taboo, it's very freeing, especially when it's in a therapeutic setting. By the second day, there's this remarkable turnaround with everybody. It's unbelievable the difference you can see in them. We treat breast also. Obviously, you don't want to see your doctor and get all the necessary tests, but most breast cysts, anywhere in the body actually, are fascial restrictions that have blocked the flow of fluid and energy in your body. Mm-hmm. So the tissue's forced to swell. That's called a cyst. It becomes inflamed. And I can't tell you how many people have been able to eliminate the surgery because they just went away. Mm-hmm.
And there's been even documented research out there on that now too, which is great.
Yeah.
So, I thought just there about when you talked about the tilting of the uterus, and then of course there's also
my uterus tilted. It was hell.
You know, even in Netter's anatomy book shows, you know, the examples of the retroversion, all this stuff. It's just, you know, you're only looking at a piece of it because the fascia is completely ignored, right? But what I always find interesting is patients that I see who've had traditional women's health treatment, and they're always trying to strengthen. So nobody's talking about, you know, releasing the fascia so that muscle fiber can actually work because it's stuck in this, you know, straitjacket.
Right.
So I've seen so many women that way. You've had, you know, problems. Their doctors are starting to learn about women's health, but then they're getting a traditional treatment that's using some maybe biofeedback when they're trying to have them contract, and then they're not talking about releasing that tissue that's actually pulling everything down.
Right.
So I feel like, you know, that's a lot that's not really understood.
Yeah, so going along with the scenario, you're right on. When our pelvis twists, that shortens the muscle. When you shorten the muscle, it weakens. Then the fascial system tightens down.
Mm-hmm.
It makes things worse. And I've found that exactly what you're saying is that we will bring up Kegel exercises to our patients. And most will resist that because they've tried it and it didn't work.
Mm-hmm.
So I fully understand that's because you didn't have myofascial release.
Mm-hmm.
So that, and this applies to athletes too, but so that when you combine this with myofascial release, it'll work, and it's very important you strengthen your pelvic floor.
Mm-hmm.
So you combine that with that, and then that can be also horrible prolapse problems.
Mm-hmm.
So when your pelvis twists, the adductors, which is inside thigh muscles, tighten down, it fascia reaches up into your pelvic floor from your leg. You got this enormous pressure with a weakened pelvic floor pulling your organs down and out.
Yeah.
So you release the adductors, you release all the associated areas, and in most cases it's going to be okay. Mm-hmm. Sometimes it's too late, but and the same with bladder. Huge problems with bladders too. So.
Yeah, and that's what's so beautiful about this work. I feel is it's about releasing what's pulling it, not that it just dropped. you know,
right.
There's this pressure and this pulling from completely different mechanism.
Exactly.
They're acknowledging.
Exactly. We have to look at every organ of our body as a fascial sac that should be capable of expansion and contraction. Every nerve, blood vessel, and duct that feeds into every organ is a fascial structure within a larger fascial structure. And they're all meant to glide upon one another. We get fascial restrictions. These fascial sacs we call organs are being crushed. The ducts, the nerves, the blood vessels, all of that is not functioning properly, including fallopian tubes. That's why a lot of women cannot conceive, because you have 2,000 pounds per square inch of pressure on a fallopian tube. Sperm can't get into the way nature intended for it to happen. Just another little side thought, I think you might have seen these videos. Some of you have seen the videos. When a sperm hits the egg, there's a flash of light, there's an explosion.
Yeah, I saw that video.
Life is light, you know,
Yeah.
we're light beings. So it's really important to resolve that and strengthen the pelvic floor, but you don't have to do it properly till you rebalance the pelvis and release all the associated areas. You know? And it makes a world of difference for you. I tell a lot of stupid jokes in the seminars just to make a point, but lighten things up a little bit. So you've all heard it. One of them is that you've all seen these commercials recently about bladder problems. There's some problem called PLS or something like that, you know. And they're talking about the wonders of this drug. And then all of a sudden the picture changes. And there's this little girl skipping through a field of daisies, ever so happy. But you hear this voice and it's speaking very fast and very low. However, it may cause carbuncles, fistulas, high blood pressure, thoughts of suicide, severe menstrual problem, on and on and on. So, you know, I'd rather pee my pants than go through all that, you know, but it's ridiculous, you know. And be careful of these bladder slings. They may need them once in a while. And if you're treating somebody with a bladder sling, You have to be very gentle with them. But most times, if you do this work, they won't have to go through that surgery.
Mm-hmm.
So think about your bladder. It is a sac that is designed to hold fluid for a prolonged period of time. But if you have 2,000 pounds of scrunchie pressure around the bladder, it can't expand.
Mm-hmm.
So that is what you lead into frequency, urgency, or incontinence.
Mm-hmm.
And in a short period of time, most of that is resolved instead of getting up 6-7 times a night.
Oh yeah. I've had patients who were getting up 4 and 5 times a night and then were able to sleep all the way through that work, which is great. Which, when I had my second C-section, it was taking a while after she was born, and of course they have this, sheet up so you can't see it. At one point he looked over, he said, "Sorry this has taken so long. You had a lot of adhesions around your bladder. I'm trying to clear them off." I'm like, oh great.
Create a few new ones here.
Right. So, but I had an interesting thing happen a few years later. So I feel like maybe you can speak to this too, scar tissue and how it can get worse over time. Because I've treated some patients who had a hysterectomy. This one person I'm thinking of, it was 12 years prior, actually, a few different people I can think of right now, 10 or 12, 15 years earlier, and they weren't having any issues, any pain or problems, and then all of a sudden it comes up and you can, you feel these restrictions are there, and they're like, what? Why? That was so long ago, like they think it doesn't matter anymore. But a few years after I had my C-section, I started getting some discomfort. I realized I wasn't doing as much self-care with a small ball that I had been doing. And so I got a little, kind of freaked out about it, like I better get this checked out. And I went and had my annual anyway. I said, do an ultrasound first so I could talk. And of course the physician knows the type of work that I do. I just want to make sure there's nothing going on in there, before I really start hitting the ball again, basically. And of course there was nothing there. He says, yeah, this is adhesions because it's not showing up. And I would send you to you. So that was then, affirmation that I could start working on it again. So I started doing a lot more self-care. Had to seek out, go see someone who could treat me. But within a couple of days of self-care, that pain was relieved. And part of it, I think, was also my, mentally I was really okay. No, and everything's okay. This is it, and I can go with that. But scar tissue.
Well, what we're not told is scar tissue grows in you like a vine.
Mm-hmm.
And so the sooner you can retreat the scar, the better. You have to wait till the process has started to heal.
Mm-hmm.
You don't use any heavy pressure near the scar at all. So this goes for scars anywhere on the body. The sooner, my fascial therapist check every scar on your body, even ones that small. You never know.
Yeah.
Because it's tightening down and reaching in different parts far away from where the scar was sometimes. I have a lot of women that have had hysterectomies and C-sections, like you were mentioning. And they have hysterectomy, so why treat me? I have no organs. Mm-hmm. But your nature abhors a void. And that whole area is filled in with scar tissue. And then, I don't get into this necessarily with the patient because you don't want to stir up their belief system, but we have electromagnetic organs that are still there and they need to be treated. So we're an electromagnetic being. And this has been completely, that's who you really are. So you need to treat the scars, you need to treat the electromagnetic organs, who you truly are, and that's what really helps a lot. But even umbilical scars, a lot of women have had surgery, microsurgery there. Who would think a scar that small could be any problem, but it can be a huge problem.
It goes all the way through.
Yeah.
Amazing. So the scar tissue, though, it doesn't really, like I use this type of wording with my patients, it doesn't ever go completely away, obviously, but over time, I feel like in certain areas that aren't, like for my scar, what I feel like, because it's not moving, like if it was something on a joint, you're using it all the time, you're keeping it mobile, and then here, it's not, there's not a chance to really work it out, so to speak, or keep it soft. So self-treatment is important over the scar, because that tissue is never going to be normal again. So it has tendency to be tight, to get tighter again, kind of like that experience that I had. I had been doing fine with it. I wasn't self-treating as much, and then the symptoms started to come back. Am I thinking that through the way that you would say?
Yeah, the scar is going to be there. Some scars you can soften, but it's the associated areas that are becoming tighter and tighter. So opening up the associated areas into the scar to what level it can be can really help a lot.
Yeah, so the hip stretches and things that I do really help to pull into there, and I feel
that's
that
right.
sensation. Yeah.
If you think of the energy of our body, because scars and fascial restrictions are like scars in a way. They interfere with the energetic flow of our being.
Mm-hmm.
It should be going through us like an uninterrupted laser beam. If you think of a raindrop falling, then you think of a raindrop falling as a ledge and hits and scatters. That's what happens with scars. It's scattering your energy, it's creating chaos in your body. It's a big problem.
Yeah.
So so don't hesitate to treat any scar, even ones that are very 20, 30 years old, because you still will make an impact.
Yeah.
You're never guaranteeing healthcare, you don't really sure, you just do the best you can. But most of the time the results are surprisingly positive.
And lastly, on women's health, I think I just would love to hear how you would approach this is, just with this part of our body, I mean, with cultural belief systems or all kinds of different belief systems that we have, or even the way people feel about their own bodies. I feel like that has potential to get stored in that area and cause a lot of problems. So again, that's that subconscious holding pattern.
You're
right,
talking about
area.
your self-image, is that what you're referring to?
Well, yeah, I mean, it could be issues around even sex, gender issues. There could be belief systems, religious belief systems, around relationship issues, around sex, around all of these different things. I feel like there's, if there's taboos, like you were talking about, cutting down the taboos in the women's health course. But I see this too in patients on occasion where there's they have problems with this area of their body because of whatever reason, and for some it could be trauma or rape, like you mentioned, or other type of emotional issues around that. This treatment, I feel like, helps people get to the area, but sometimes that's not even, they can't even go there, So how can we help people with that barrier? Right? Is that making sense?
It is. It's really important. Somehow through the treatment, most people become very accepting of who they are, exactly the way they are. As therapists, we want to encourage that also. We spend a whole morning treating breasts, as I said in the Women's Health Seminar. It's absolutely astonishing every time I give the seminar how much emotion women hold in their breasts, not just their pelvis area, And I sort of kiddingly tell them that, everybody's feeling their breasts are too small, too soft, too hard, da-da-da-da-da-da. Not just your breast. The key to being happy is to accept yourself just as you are. We have to give up this so-called norm that society taught us we should be. Both the way we look at ourselves, the way we act. Again, you have to let go of some of these taboos. And it really shapes our behavior and our physiology. And the more we can accept how we are, it's okay to be fat, or it's okay to be lean, or whatever. And it's a power. Accept your uniqueness. There's power, there's extreme power in that. And love yourself for just the way you are. And there's a really good book called Psycho-Cybernetics, Psycho/CYBERNICS, by Dr. Maxwell Maltz, MALTZ. He was a plastic surgeon. He was world renowned. And he spent decades of his career doing cosmetic surgery, faces, breasts, whatever, And he just was astonished that even though he had supposedly made the person look better, most of them are still miserable because it was their self-image.
Yeah.
And I really recommend that book to everybody and every patient and client. We all need to read that. And what he's saying is we need to upgrade our self-image once in a while. So through myofascial release, that seems to happen, but it's really helpful for the therapist then to encourage the patient. Just honor their uniqueness and love yourself for the way you are. I mean, loving yourself is something that's also pretty alien to people.
Yeah.
So at least get them to start to like themselves. They work your way into love.
Yeah.
I've said this to you before too, but I run into a lot of wealthy people. And as I'm treating them, there's this immense feeling of sadness pouring out of them. You know, they have all the toys, cars, boats, homes, jewelry, and all that. Because they're in Channel 5. Channel 5 is empty. If you're not enjoying yourself, what the hell's the purpose of life? But we all got this message, so we're here to suffer. And we didn't even know we had the message. We're trying to fulfill suffering to be a good person. That's a lot of crap. And get this across to your patients. We're here to enjoy our life and help other people do the same. And that's what Myofascial does for us. There's hope. So there's nothing wrong with having all the toys, but enjoy your life. Even if you don't have a lot of toys, enjoy your life. Enjoy enjoy every moment. You don't have to be giggling the whole time, but appreciate the beauty that surrounds us every moment of our life. And if you enjoy every moment, there's a flow that begins to occur. You start to heal, and your life turns on to a whole new quality. And that's what MFR does for other people too. So our society sure needs it right now. You know?
Yeah.
It's locked in fear. It's horrible.
It's like letting go of that myofascial resistance helps to let go of the resistance to enjoying our life.
Yeah.
You know?
You get guilty.
Yeah.
It's crazy when you think about it. You know?
Yeah.
Animals enjoy their life. See, Channel 3 is your animalistic side. It's okay to be an animal once in a while.
Speaking of animals, it made me think of your out on the story you tell when you took the class out to the Red Rock to do, I don't know, it was unwinding or something, and the ranger came up.
Oh yeah.
Encouraging everyone to have their animal side, right?
Yeah. What she's referring to is the Myofascial 3. That's one of our advanced seminars. The second day, we do a lot of techniques, but we go outside a lot too. And the second day, we spend over an hour and a half each. Therapists pair up, one's patient, one's therapist, then we eventually switch, so it's about 3 hours. And the whole idea is to get into your power animal, which is Native American symbology for our intuitive instinctive side, which is Channel 3, what we've been talking about. So one day we were doing that in MFR 3, and I was in the back of the room for a bit. And the day before, actually, a guy had come up to me as part of the class, and he was very frustrated because he'd never been able to really center himself. And I said, don't worry about it, just have fun, and it'll happen over the next couple of days. Don't put a lot of effort into it, because the more we try, the worse it gets, you know. It has to be more of a surrender into that acceptance, into that whole experience. Channel 5 is about doing, making things happen. Channel 3 is about allowing things to happen. Anyway, a lot of crying and screaming in the class, a lot of activity. And all of a sudden I saw the guy had come up to me crawling on the floor on all fours, sniffing everybody's butt. So he found his power animal. Don't judge your power animal. Animals will be animals. Then in the back of the room I heard, ew, ew. And I looked over and there's a 7-month pregnant therapist up on a table, whinnying like a horse, prancing around like a horse, you know. I could write a book just on the seminar experiences. So the next day, then I give them instructions not to talk that night to anybody about their experience. I don't want to cheapen the experience. And then the next day, don't say a word until we get up to an area here that's called Bell Rock, which is a beautiful area. So we climbed halfway up Bell Rock and found a nice ledge. And somebody had brought a stereo, so we're playing some drumming music, and I had everybody doing jiggling, which is a form of rebounding, and dancing a little bit. And all of a sudden, a park ranger shows up with a whole outfit on, the hat, the clothes, the badge, and everything, you know, looking really upset. Who's in charge here? I said, I am. He comes, what's going on here? I said, oh, we're just some friends having fun. Whatever. He points at the, what's that? And I said, it's a stereo. Well, the federal law doesn't allow motorized, that's motorized equipment. He said, you're going to have to take that down the hill. I said, oh, no, I'm not going to do that. No, I was about 2:30, he was about 1:30. And he's glaring at me. You know when you're in a fight with somebody, you make eye contact. So he's glaring at me, and I said, I'm not going to do that. And all of a sudden his eyes start to divert. And I heard, ew, ew. She's prancing around. And so I turned around and he was going. So he took care of the whole problem. It was really funny.
Great.
Yeah.
So great talking with you.
Thank you. Good to see you again. So I've known you for 20 years?
Yeah, at least I think.
Yeah.
Yeah. My first time coming through here was in late 90s, so I had heard about, well, I saw your video in PT school, and then the instructor, even though she hadn't done an MFR, I'm so glad that she did that. And then she gave us a lab, so we practiced pulling and cross hands, you know, and I'm like, I like this stuff. There's something about it, you know. Then, as the universe would have it, my very first, at the end of all of your training, internship, where you're there for 6 weeks, you know, for the first one, then there were 3 different. So my very first one, my clinical instructor was so excited that morning, my very first day, because she had just gotten back from one of your courses, MFR1, and I just couldn't believe it. I got tingles all over I'm like, you're kidding me, that's what I want to do. She's like, I'll teach you everything that I learned this weekend. You can look at my book, you can, you know, do as much as you want. You can spend as much time on each patient as you want. And I was like, great. Wow, you know, I felt like I had just won the lottery, and that's, I had so many amazing experiences. And you know, as a PT student, when you're in that situation, you don't trust yourself, you're doing these evals, you know what you're doing, you know, and there's a lot of anxiety. And I was just so excited to be able to have her show me and then use this. And I had this amazing experience which formed the rest of my life, really. This guy was 34 years old. He'd had a heart attack. And of course, he was still having pain in his chest, and the medical people didn't know what to do with him. So what do? They sent him to physical therapy. You know, they're here, see if the therapist could do something with you. And lucky for both of us, he was on my schedule. And I remember he was one of the first full evaluations that I did, you know, by myself without the clinical instructor. And so I'm thinking, okay, well, he's having this pain. Everything looked fine. His range of motion was fine. But he had this chest pain still for 18 months. And he'd had this heart attack and, you know, a whole bit. So I'm like, well, I'm just going to do what I learned. And I started doing cross hands on his chest in different directions. And I'm okay, well, I'm going to pull his arm. I pulled both arms. And then I had him roll over and I did more cross hands on his back. And time was up by then, an hour later, you know. He came back the second time and he says, I don't know what you did to me, but I haven't had pain since I saw you last.
That's great. And
I had to control my, you know, being shocked, but I was like, that's awesome. Well, let's do it again. we'll do it all again for good measure, you know. And then I think that was the only time he came. That was it. He came 2 or 3 times, and he was good.
That's great.
And it blew me away. And I always knew that I would, you know, study this, but I was doing my PhD at the time, and I had like 3 more years of working full-time as a PT and going to school full-time, working on all that, so I couldn't go to any courses. So and that was in 96 that I graduated. So I came across this area on a hiking trip by myself. I was just out in this area, and I'm like, I gotta go through Sedona. So I went, and I'm looking at the Sedona guidebook, you know, and I saw your ad. I'm like, oh, I didn't realize that you were here because I was too busy doing other stuff, even though I'd been using your techniques as much as I could. And I decided to call and see if I could just have one appointment. So I did. And that was when I had an appointment up here. And that was probably 97 or 8-ish. So it took me a minute to go to a full course because I had to be in a place to do it. But there's nothing like, you know, people who say, oh, they do myofascial release and they've had, you know, one class or they had a little intro here or there. It's not the same, is it?
I sure wish more PT schools were like that.
I know, and they don't do it anymore. That's the upsetting thing. When they shifted to the doctoral program, the DPT program, and they got a new chairperson there, I was doing just a few. I would do like a 4-hour lecture and lab together for the students. I did that for 2 or 3 years when I came back to the area, and they don't do it anymore. So I don't know.
Yeah. Well, as you know, Dr. Carol Davis down at University of Miami had a myofascial course there for quite a while. So
those students
she made a wonderful impact on a lot of people. I still see a lot of her students, and they absolutely love her, and she's great. So it's just, you know, Anyway, nice chatting with you.
Yes,
Good to see
thank you.
Bye, everybody.
Thank you, John, for this important perspective on women's health and myofascial release treatment, where we recognize that the fascial system controls the organs of the pelvis, and restrictions and scars can affect even the brain, hips, and more. Rebalancing the pelvis is important before strengthening. The Women's Health Seminar can teach therapists how to treat many women's health problems. If you need treatment, you can seek out John Barnes Myofascial Treatment Centers in Sedona or Malvern, Pennsylvania, or find a therapist near you who's been trained with the Women's Health Myofascial approach. Check out myofascialrelease.com for more information, and thank you so much for watching.